What if I told you that the position you fall asleep in tonight could be quietly increasing your risk of having a stroke before you wake up tomorrow morning? I know that sounds alarming, and honestly it should, because most people have no idea this connection even exists. I'm Dr. Jason Reed, and in my years of practicing cardiology, one of the most overlooked conversations I have with patients is about sleep. Not how long you sleep, not whether you snore, but the actual physical position your body is in when you're unconscious and vulnerable for 7 or 8 hours every single night. So stay with me, because what I'm about to share with you could genuinely change, and I don't say this lightly, it could save your life. Let's start with something most people don't think about. When you go to sleep, your body doesn't just shut down. Your heart is still pumping, your blood is still flowing, your brain is still receiving oxygen. But here's the thing, the way blood circulates while you're lying flat is very different from when you're upright and moving around. Gravity behaves differently. Pressure distributes differently throughout your cardiovascular system. And that matters enormously, especially if you already have any underlying risk factors, things like high blood pressure, thickened arteries, atrial fibrillation, or even just a family history of heart disease or stroke. You might be thinking, Dr. Reed, I've slept the same way my entire life and I've been fine. And I hear that. But fine isn't the same as optimal. And many of my patients who've had nighttime strokes said the exact same thing before it happened to them. So let's talk about the specific position I'm warning you about. Sleeping flat on your back, what doctors call the supine position, is the one I want you to pay close attention to. Now, I want to be precise here, because I'm not saying back sleeping is dangerous for everyone across the board. But for a significant portion of people, particularly those over 45, those who are overweight, those with any form of sleep apnea, or those with cardiovascular disease, sleeping flat on your back can trigger a cascade of events that dramatically increases stroke risk overnight. Here's why. When you sleep on your back, especially without adequate elevation, your tongue and the soft tissues at the back of your throat are much more likely to partially collapse into your airway. This causes something called obstructive sleep apnea, even in people who don't have a formal diagnosis. And here's the critical part. Every time that airway gets partially blocked, your oxygen levels drop. Your brain senses the drop in oxygen, sends a distress signal, and your body releases a surge of stress hormones like cortisol and adrenaline. Your heart rate spikes, your blood pressure jumps, and your blood vessels constrict, all while you're completely asleep and completely unaware that any of this is happening. Now imagine that cycle repeating itself not once, not twice, but potentially dozens of times in a single night. Every single apnea event is a micro-crisis inside your cardiovascular system. And over time, that repeated stress makes your blood more likely to clot, your arteries more likely to become inflamed, and your risk of stroke, both ischemic and hemorrhagic, goes up significantly. But it gets more specific than that. There's also the issue of what happens to blood flow to the brain itself when you're lying flat on your back. Certain patients, particularly those with stenosis in the carotid arteries, which are the two main arteries running up the sides of your neck, can experience reduced blood flow to specific regions of the brain during back sleeping. The angle of the head, the relaxation of the neck muscles, and the compression that can occur in that position all contribute. In a clinical setting, we call these events transient ischemic attacks, or TIAs, often called mini strokes. And many of them happen at night, while people are sleeping, and they go completely unnoticed until the person wakes up feeling off, or worse, doesn't wake up functioning normally at all. Now let me talk about one more mechanism that I think is really important, and that most health content online completely ignores. When you lie flat on your back, your heart actually has to work differently to maintain adequate blood pressure. In some individuals, especially those with heart failure or poorly controlled hypertension, lying flat causes what's called orthopnea, where fluid redistributes from the lower body up toward the chest and the brain. This increased fluid pressure can cause spikes in intracranial pressure, and in vulnerable individuals, that spike can be the final trigger that causes a blood vessel in the brain to rupture. That's a hemorrhagic stroke. And it can happen quietly, in the dark, while you think you're just getting a good night's rest. So what should you do? Because I'm not here to scare you without giving you real actionable guidance. That's not what this channel is about. The first and most important thing I recommend to my at-risk patients is to sleep on your left side. And I want you to really hear this. Your left side. And here's why that's not random. When you sleep on your left side, you're taking pressure off the inferior vena cava, which is the large vein that carries blood from your lower body back to your heart. You're also improving lymphatic drainage, reducing acid reflux, which by the way has its own connections to nighttime cardiovascular stress, and you're keeping your airway more naturally open because gravity is working with you instead of against you. Studies have shown that left side sleeping is associated with better cardiac output and improved circulation, particularly during the deeper stages of sleep when your blood pressure naturally dips. If you're a committed back sleeper and the idea of changing your position sounds impossible, I understand. Humans are creatures of habit, and sleep habits are some of the hardest to change. But there's a practical compromise. Elevate the head of your bed. Not just adding an extra pillow under your head, which can actually strain your neck and make things worse. I mean, actually elevating the entire upper portion of your body by about 30 to 45 degrees. You can do this with an adjustable bed frame, with a wedge pillow designed for this purpose, or by placing risers under the head end of your bed frame. This elevation keeps your airway more open, reduces the chance of fluid redistributing toward your brain, and takes significant pressure off your cardiovascular system through the night. Now I want to address right-side sleeping specifically, because I get asked about this constantly. Right-side sleeping is generally better than flat-back sleeping, but it's not my top recommendation. When you sleep on your right side, there's some evidence suggesting that the heart's position relative to the pericardium, the sac surrounding it, can cause a small but measurable increase in certain cardiac pressures. For healthy individuals, this is probably not clinically significant, but if you have any history of heart failure, cardiomegaly, or arrhythmias, I'd steer you toward the left side when possible. And what about stomach sleeping? I know some of you love sleeping face down. From a stroke perspective, stomach sleeping poses its own unique risks. The rotation of the neck that's required to breathe when you're lying on your stomach can compress the vertebral arteries, the arteries that run through your cervical spine and supply the back of your brain. Sustained compression over hours of sleep can reduce blood flow to the posterior brain regions, which control balance, vision, and coordination. When that blood flow is compromised repeatedly over months and years, the risk of vertebrobasilar strokes goes up. So, while stomach sleeping feels comfortable for a lot of people, it's one I consistently discourage in my practice, especially for anyone over 50. Here's something else I want you to take seriously. If you regularly wake up with a headache, if you feel groggy or confused for more than a few minutes after waking, if your partner has ever told you that you stop breathing in your sleep, or if you ever notice numbness, tingling, or vision changes when you first get up, please do not dismiss those symptoms. Those can be signs that something is happening to your brain's blood supply while you sleep. Come see a cardiologist or a neurologist. Get evaluated. Because a stroke doesn't always announce itself with dramatic symptoms. Sometimes it whispers. And the people who listen to that whisper are the ones who avoid the catastrophic event down the road. Before I wrap up, I want to leave you with 3 things you can do tonight. Not next week, tonight. First, try transitioning to left side sleeping. Put a pillow behind your back to prevent yourself from rolling onto your back if you tend to shift during the night. Second, if you snore or suspect you might have sleep apnea, talk to your doctor about getting a sleep study done. Untreated sleep apnea is one of the most significant and modifiable stroke risk factors that exists, and the treatment, usually a CPAP machine, can dramatically reduce that risk. And third, check your blood pressure tonight before you go to sleep. If it's consistently above 130/80, that's a conversation you need to have with your physician, because hypertension is the single greatest risk factor for stroke, and it does its most dangerous work while you're asleep and not monitoring it. Your heart doesn't stop working when you close your eyes. It keeps going, doing its job, trusting that you've given it a fighting chance. Something as simple as the position you choose tonight is within your control. And in medicine, I'll take every controllable variable I can get. I'm Dr. Jason Reed. Take care of that heart, and I'll see you in the next one.